appreciate all of you joining us today, and I hope you all are healthy and well. So today we are going to talk about some sad topics: the deadly Delta variant, sadly, record-breaking numbers, a lack of hospital space, ICU space, and our new ask for federal assistance. Joining us is State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig. Dr. Dobbs, why don't you start us off talking about those record-breaking numbers?
Absolutely. Thank you, Liz. It's been kind of a hard time around here at the Department of Health. Just to be honest, it's been exhausting. I think we're all emotionally spent. I kind of personally feel like I'm an air traffic controller, and every day I'm watching two airliners collide, and we're constantly warning to change course, and we never do. It's really distressing to see what's going on and know that almost all these deaths are preventable. I was talking to an ICU doctor just the other day. They had a healthy mid-30-year-old guy, 2 kids, wife, came in the hospital with COVID, and his only situation was he was a little bit overweight. And in a couple of days, he died. COVID killed him. And the doc was sitting in the waiting room talking to the mom, and she was just beside herself because she'd been trying to get him to get a vaccine for months. And he thought he was too tough. He didn't think he needed it. He was too young. He didn't have serious medical issues or anything. And now we have kids who don't have a dad, and we have a wife who doesn't have a husband, all for the want of a simple vaccine. So these are the tragedies that we're going to be telling every single day. We're seeing more and more deaths in younger age groups, and no longer are people 65 and older the leading group for mortality. It's people in their 50 to 64 range. And there's a very simple reason for that. And that's because the vast majority of our 65 plus folks have been immunized, and only about half of those 50 to 64 have been. So we've got a lot more tragedy on the way. It's very distressing. So I'll go ahead and share the slides I have for you guys, and I'll make these available also. So if we see where we are, this week we reported the highest number of single day cases early this week at almost 3,500. Our daily average number is almost 2,700, as you can see, far higher than ever in any previous peak we've seen throughout the pandemic. You can see that we are just now, if we're looking at new hospitalizations, we have just now surpassed what we saw in the worst of the winter, and speaks to the challenges that the health systems are facing. If we consider what we're seeing with hospitalizations, you can see that our daily admissions continue to climb at a staggering rate. And if we look at the rapidity of this rise, it's really kind of terrifying and awe-inspiring. If we see what we're doing, we already have essentially zero hospital ICU capacity, and we have dozens of people waiting in ERs to get an ICU bed. And within this population, a large number of them are going to end up in the ICU. We know from historical perspective that for every 100 cases, about 7 to 8 of them are end up in the hospital. So every day we report 1,000 cases, we're going to have 70, 80 new patients being hospitalized. And this is on top of an already full healthcare system. If we look at these 224 people, we know from our historical data that about 15% of these people are not going to make it. If we look over here at their ICU use and our ventilators, we know that about 1/3 of folks who end up on the ICU are not going to make it. And about 2/3 of those who end up on ventilators are not going to make it home to their families. And you can see why it's so distressing, because we know that these things are mostly preventable. If we look at our daily hospitalizations, most of the cases are being hospitalized are under 50. I want you to absorb that. Most of the people who are being admitted to the hospital are under 50 years of age as these different age groups, which is very different from what we've seen before. And you can see we're seeing more and more pediatric hospitalizations than we've seen, and have peaked beyond what we saw, a little bit from what we saw in the winter. And we expect we'll see more and more of this, especially as we see transmission around school settings. To be very clear, the vast majority of new cases are unvaccinated. 97% of our new cases are unvaccinated. And from this rapid transmission, we see spillover into other parts of the population where we see older people, people with weak immune systems who are also being affected, such that 11% of our hospitalizations are vaccinated, 17% of our deaths are vaccinated. Among this breakthrough death group, the median age is 78, and more than half have serious underlying immune issues and immune compromised states. But regardless, even so, the vast majority of hospitalizations and deaths are in unvaccinated folks. We wouldn't be having the same situation at all if we had a higher vaccination rate. The good news is we are starting to see an increase in number of daily immunizations. We more than tripled our rate compared to a month ago, which is fantastic, but we have a long way to go. We still have over 1 million Mississippians who need the protection from COVID, from Delta. And I just want to reiterate this point because I think it's true and more obvious than ever that people are either going to get the vaccine or they're going to get COVID. And this Delta variant is so contagious, leading to so much death and misery, that we really need to do everything we can to prevent this transmission. So please, if you're not vaccinated, please go ahead and get vaccinated. But no, it's going to take a few weeks for full immunization effect to be available to you to protect you. But the other thing is, if you get COVID, please talk to your physician, your medical provider, about monoclonal antibody treatment. We have networks throughout the state, and we're adding additional capacity, which I think Jim may talk about a little bit, trying to make sure that if people do get COVID, they can get monoclonal antibody treatment, which can reduce hospitalizations by 80, 90% and cut the mortality rate substantially. So get vaccinated, but if you get COVID, even if you're vaccinated and you get COVID, please talk to your doctor or provider about monoclonal antibodies. And Liz, that's all I have. I'll kick it back over to you.
Thank you, Dr. Dobbs. Dr. Byers, can we start with today's numbers? Can you start us out with our current numbers for today?
Yeah, we sure can. Thank you, Liz, and thank you, Dr. Dobbs. And, you know, I just want to start out by saying that we are seeing some really significant increases in the overall number of cases. And as Dr. Dobbs said, we're seeing indications of the impact on younger individuals now. And we'll look at a little bit of that data. But if you'll give me just a moment, and hopefully we'll share those slides. So today we are reporting out an additional 3,163 cases and 25 deaths. That brings us to a total of cases that have been reported of over 370,000 now and over 7,700 deaths. We currently have 160 long-term care outbreaks. And if you remember when we were in the largest previous surge, those numbers are now beginning to become comparable to what we saw previously. When we look at the 25 deaths and look at the 36 deaths that we had reported in the previous day, for that 2-day total, that's 61 deaths that we've had. And as Dr. Dobbs indicated, we are starting to see an impact in younger folks. 26% of those deaths were in individuals under the age of 50. And we saw several deaths in individuals in their 20s. Sadly, 2 of the deaths occurred in pregnant women. Now, vaccine is safe and effective and is strongly recommended in women who are pregnant, who are women who are of childbearing age. There have not been any indications of problems with fertility as a result of getting the vaccination. There have not been any increases in miscarriages from the vaccination. in pregnant women. As a matter of fact, the risk of having complications from COVID is far greater than the risk associated with the vaccine, which are none. We've had over 7,700 deaths due to COVID in the state, and we've had 0 deaths due to vaccination. I would just like to reiterate what Dr. Dobbs said, that when you're making a decision now that you're going to delay vaccine or that you're not going to get the vaccine, what you're doing is making a decision to increase your risk of being infected with COVID. And when you become infected with COVID, not only are you putting yourself at risk, but because of the highly infectious nature of the Delta variant, you're putting individuals around you at risk. And these are individuals who are vulnerable, potentially, who may have severe outcomes, hospitalizations, and deaths as a result of an infection. And so not only are you taking that risk for yourself when you're not getting vaccinated, but you're putting those people around you at risk. I just want to make that clear. When we look at where we are with our cases, you can see how rapidly we have increased in the number of our cases, really surpassing where we were with what we thought was our previous large surge back in January and December and February. And you can see how rapid the increase is. And these case numbers, they translate into hospitalizations and they translate into deaths. The more individuals that we have infected, the higher the chances are that we are going to have more hospitalizations and that we're going to have more deaths. You can't have more cases among unvaccinated, unprotected individuals and have an expectation that we're not going to see these severe outcomes. When we look at deaths, we are starting to see some increased numbers of deaths. And like I said, the impact is on younger individuals. We are starting to see more deaths in individuals in their 50s and younger. And these individuals are unvaccinated. Dr. Dobbs talked about the breakthrough cases. And when we look at our vaccine breakthrough deaths, he mentioned what we're seeing with those individuals who are dying. And by and large, these are individuals who are older, who are vulnerable, who may not have mounted as robust a response from the vaccine as younger individuals may. It's imperative that we protect those people. And the way to do that is to get around those people to get vaccinated. And if you are an individual who's over the age of 65, or you're an individual who's vulnerable, get vaccinated if you're not. Wear a mask when you're out in public and avoid those large gatherings where transmission may occur. Keep yourself out of harm's way. Keep yourself out of risk. 80% of the deaths that we're seeing in fully vaccinated individuals are over the age of 65. We've got to do what we need to do to protect those folks. And if you're in one of those groups, make sure that you're taking those steps to protect yourself. We talked about the younger age groups that we're starting to see an impact on. And when you look at our overall proportion of cases by age group over time, you can see that the proportion of cases that we're seeing in younger individuals in 0 to 17 is increasing. We're seeing increased numbers of cases in individuals 25 to 39. Thankfully, we have seen decreased cases in individuals who are over the age of 65, and that's primarily due to protection that we're seeing from the vaccination. When we look at our hospitalizations, we're seeing some similar data. We're seeing increased proportion of our hospitalizations among younger individuals. If you compare where we were in January for 40 to 49-year-olds to where we are now, you can see an astounding increase in hospitalizations, while you see decreases in those individuals who are over the age of 65. Again, that's primarily due to the protective value of the vaccine. When we look at our deaths, you can see similar trends, increased in the proportion of deaths in individuals in the younger age groups, decreased in individuals over the age of 65. But remember, individuals over the age of 65 are still vulnerable, and they still may have infection and severe complications that can occur even when fully vaccinated because of the enormous amount of transmission that we are seeing and the spillover we're seeing from all of the cases in unvaccinated individuals. When we look at what's driving this, it is the Delta variant. More than 93% of the sequencing data that we're the variant of the samples that we're sequencing are the Delta variant. We don't anticipate that that is going to decline anytime soon. The Delta variant is so highly infectious that for every individual who's infected, they may infect an additional 8 to 9 people. Compare that to the previous strains that we were looking at that were in the range of 2 to 3. And so you can see how rapidly the Delta variant has spread. And, it continues to be the driving force. And I get a lot of questions about, how can I tell if I have the Delta variant? What is the specific test for the Delta variant? The reality is in Mississippi, if you are infected with COVID, then you've got the Delta variant. And it's just so much more transmissible that if you are infected, if you do get a positive test, please isolate yourself. Please limit transmission. Now, there have been some questions about school reporting. You know that many of our schools have returned, and we anticipate that there's going to be a significant impact in the school setting over the next few weeks due to the Delta variant. Schools are just getting started now. And, we've had this reporting system, and we made this data public last year, and we're going to make it public this year for every one of the schools that reports to us. But you can see that we've already had, with just a couple of weeks of school, 80 outbreaks in the 342 schools that have reported, 4,400 students that have had to be on quarantine as a result of exposure to COVID. More than 300 positive teachers, more than 800 positive students. And this was, again, just from 342 school systems that reported to us. So we anticipate that that is going to increase in the coming few weeks as transmission continues to occur. So we'll be publishing that, like I said. And there have been some questions about Neshoba County, and is Neshoba County the highest, the highest in the state? Well, we have had significant increases in the overall incidence of cases in Neshoba County. We recently had the Neshoba County Fair. It is certainly likely that a good bit of the transmission is a result of the fair. And it's not just limited to Neshoba County. We do have reports of cases that are being identified throughout the state where individuals either knew somebody who was at the county fair who was ill, or have been were at the Neshoba County Fair themselves. And that's the reality, guys, is that when we get large groups of folks together with as highly infectious as Delta variant is, we can't be surprised that we're going to see transmission. And, we're in the thick of it now. And any of these types of gatherings moving forward, we will see cases. We will see transmission that occurs. And I would just like to remind everybody, too, that when we look at the county landscape in Mississippi, and when you look at the data for substantial or high transmission throughout the state, every single county in the state is at high or substantial transmission. This is not limited to one county. It's not limited to one location. You can't look at a county and say, oh, well, that county has higher incidence than mine, so I don't have to take those actions. That's not the case. We're seeing transmission everywhere, guys, and we got to start taking action. You know, we can make the recommendations to get vaccinated, and we can make the recommendations to wear a mask, but we have to start taking some action as a state and make that decision that we're going to limit transmission. So I think that's everything I have, Dr. Dobbs.
Thank you, Dr. Byers. Mr. Jim Craig, can you talk to us about the alarming lack of hospital and ICU space that we face right now here in Mississippi?
Sure, Liz, thank you. The situation in many of our hospitals is much worse than what we saw last week, and I think worse than what we saw during our peak earlier this year. Our COVID system of care continues to be active and mandatory for all the hospitals in the state. And, its purpose is to help transfer patients for critical care services that just can't be accommodated by our normal referral process. So Mississippi MedCom is a very important player in that. They are the medical communications unit that helps collect the information directly from hospitals twice daily to assist in helping us drive our operational decisions related to the transfer of those patients. To date, Mississippi MedCom has facilitated the transfer of over 563 patients since the health officer order was issued. And today they reported that as of 8 o'clock this morning, there were 10 ICU beds that were open briefly, with 238 patients on hold in emergency rooms around the state. So patients continue to be transferred as beds come open. We are still seeing shortages in medical staffing, impacting both the medical surgical bed spaces and the availability of medical surge spaces in hospitals, as well as ICU bed availability. So it's not a matter of not having enough beds throughout the state. It's a matter of not having enough staff to staff those beds throughout the state. With that, we reached out to hospitals and asked what their staffing needs might be. We put together a request from 73 hospitals that have forwarded their staffing assistance requirements to us. And we're working with the federal government to see what type of aid we can bring to our state to meet some of those COVID staffing needs. We've been working with the governor and MEMA, and health department requested federal resources to assist in providing that medical staffing. And starting last night, under a federal mission assignment, our partners at the Federal Veterans Administration have provided to us 5 ICU beds at the Biloxi VA and 5 ICU beds at the Jackson VA to place into rotation in the COVID system of care. That'll be great benefit to the number of ICU patients that we have on hold throughout the state. In addition, Mississippi Med 1, which is one of our state's 50-bed hospitals, along with our mobile emergency room, has been deployed to the University of Mississippi Medical Center. To help support this deployment, we also requested a federal clinical staff package to assist. They're filling that request with a federal disaster medical team. If you remember, during Hurricane Katrina, these were the teams that came in and assisted us from the federal government in our 14 hospitals that were damaged during Hurricane Katrina. So that team is being deployed to the state of Mississippi, and some have begun to arrive in the state. Our HHS Regional Emergency Coordinator advises us that the team will be ready to begin working on Friday of this week. In addition, we've requested 10 federal medical teams to assist with the administration of monoclonal antibodies to help shore up our current efforts, but also, the current efforts and to meet the increase in demand. We're seeing an increase in demand and really tied to our higher case rates, and also maybe to create some additional capability. We have monoclonal antibodies available in a lot of areas in the state, but we do also, as Dr. Byers said, we have COVID all over the state. So we're trying to see if we can create some additional capability around the state, and as well as assist with the capacity issues that we're seeing in a number of areas. With the high number of long-term care outbreaks, our partners at MEMA and the logistics team there are working to deliver additional personal protective equipment, or PPE, to the long-term care facilities to help with those outbreaks and to assist in their infection control practices. The health equity team reports that they continue to assist in vaccination and mask distribution, and they report that over 41,000 masks have been distributed to the Hispanic community in Mississippi, and an additional 60,000 masks are on order. So I'm going to share with you just a slide right quick on testing. We can go over that. All right. We look at our testing, just remember that we continue to see increased demand for state testing sites and for COVID testing throughout the state, not just at the health department or state sites, but really at all locations where testing is being performed. Demand is high as we have continued increases in community transmission. But free or no cost testing for COVID remains available in all counties in Mississippi. And we're currently operating the 27 sites that you see here. These 27 sites are those that there was little or no free or no cost testing available in these particular counties. So some of the adjustments since we visited last in the metro area, we continue to see high demand for testing in our capital city testing location at the farmers market at West Street and Woodrow Wilson in Jackson is servicing about 600 appointments per day. As an update to last week also, we've moved to 3 full days per week testing in Marion County in the parking lot at the Marion County Health Department in Columbia. And this week we moved to 5-day per week testing in Pearl River County in the parking lot at the Pearl River County Health Department in Carriere. Next week, Lowndes County will move to 5 days per week testing in the parking lot at the Lowndes County Health Department in Columbus. Also remember, free COVID vaccine remains available around the state, including our county health departments on their normal days of operations. And really for faster service, you can make an appointment at www.covidvaccine.umc.edu. Since last week, we have seen increases in requests to vaccinate the homebound, which is great. But as a reminder, if someone is homebound and needs assistance getting COVID vaccine, they can send an email to covidhomebound@msdh.ms.gov or call the COVID hotline 7 a.m. to 7 p.m. 7 days a week at 877-978-6453. Also, we're still working to develop additional vaccination opportunities around the state. So if you're a business, city, group, someone interested in holding a vaccination event and need some help, please give us a call at the COVID hotline. We're really here to try to help you. So Liz, things are really tight in the healthcare system in the state of Mississippi right now, but I'm gonna turn this back over to you for questions.
Now, last week, you all did numbers on what the outlook would be with our ICU space, and nobody was responding to that. So let's start, thank you, Jim. Let's start with Bradley B. to everyone. Brad Roders with Local 24 News in Memphis. With the ICU hospitalization in Mississippi, what impact are Mississippi patients having at DeSoto County and Memphis hospitals? And what is the concern level of that strain in the Memphis area in the weeks ahead if things don't stabilize and slow down? Jim, you want to start with that?
I'm sorry, Liz, I couldn't hear the question. Which question are we looking at?
Bradley at the top.
From Kevin Cooper?
Yeah.
Okay.
Oh, no, Bradley Broders. I'll ask you the question again. Okay. Can you hear me, Jim? Jim?
I'm sorry, Liz, we're having a hard time hearing.
Can y'all hear me now?
It's a little bit better, yes.
Okay. Brad Broders, reporter at Local 24 News in Memphis. With the ICU hospital situation in Mississippi, what impact are Mississippi patients having at DeSoto County and Memphis hospitals? And what is concern level of that strain in Memphis area in the weeks ahead if things don't stabilize and slow down?
So yes, thank you for the question. I think as I understand it, what are the impacts to DeSoto County and some of the surrounding areas as well as in the Memphis market? Hospitals are tight, not just in Mississippi. We're tight over in Alabama, we're tight in Tennessee, we're tight in a lot of parts of the country. And just know that in normal referral processes, sometimes we have patients that go to Memphis. If you think about it, and just take trauma, for instance. In Mississippi, there's one in-state level 1 trauma facility, and that is the University of Mississippi Medical Center. but we have two out-of-state level ones that participate in the system, one being the Med in Memphis and the other one being USA down in Mobile. So those are kind of normal referral processes that occur without COVID and just trauma. But because COVID is a true complicator right now for our ICU spaces, we're seeing strains on not just in DeSoto County and into the Memphis market, but also some of our surrounding border states.
Thank you, Jim. Kevin Cooper with Boom Newspapers. Earlier this week, Dr. Dobbs mentioned in social media that X number of new cases statistically revealed X number of hospitalization and ultimate deaths. Can you share the percentages he's using there, Dr. Dobbs?
That's based on our historical data, what we see, and we know we follow this metric throughout the pandemic that, and this is on the low end, it does vary, but on the low end of the range, 7 to 8% of cases, of diagnosed cases, will end up in the hospital. So that was based on the 7 to 8% figure, but keep in mind that's on the low end of the range, right? It could be worse than that. And for the deaths, we know that of all reported cases, we have a mortality rate of about 2.1%. And if we look at our hospitalizations, we know that about 15% of people hospitalized won't make it out back to their family. So that's based on our historical stuff, and some of those numbers are extrapolated from the data on our website.
Okay, and let's see, earlier UMC reported they were caring for 26 children. What's the capacity of UMC's pediatric units, both regular rooms and ICU? Are all pediatric cases in the state included in that number, or are some being treated in regional facilities? With the latter, can you share a total count of current pediatric hospitalizations? I think we did. Did we not share that, Dr. Byers?
I did, but on the slide, it showed that our most recent report had 14 children in the hospital. And then I just got an update that 6 in ICU and 4 on life support. As far I know that UMC had a press conference earlier today, and they referenced that they're really feeling some stress in their pediatric ICU capability. Certainly would get more details from them, but also remember that we're only reporting on Mississippi beds. We're not including the Mississippi kids who are in Louisiana, Alabama, and Tennessee. So there are going to be more than the number that we're counting.
Okay, thank you, Dr. Dobbs. Maya Martin with the Oxford Eagle. Bill Henning, CEO and administrator of Baptist Memorial North Mississippi, is trying to reassure residents that there is still enough room for residents. We're trying to reassure residents there's still enough room for them, but reports from patients are saying the opposite. Patients are getting stitches in waiting rooms and professionals converting rooms to treat COVID-19 patients. Do you have any details about what is going on at Baptist Memorial? How should administrators, hospitals communicate with the public about hospitalization capacity and available beds? I think they have been. Let's see. Jim, do you want to try to take that?
And Liz, again, I couldn't quite hear the question. Could you tell which one it's from, and I'll pull it up in the chat?
Yeah, it's pulled up on the chat under Maya Martin.
And Liz, I heard it. I can take it. Since I've, so we certainly wouldn't presuppose to tell local CAOs in their community, they have the best interests of their folks at heart. I think an important part of this is people don't need to delay urgent care. And so is it going to be different? Yes, but we don't want people who have having chest pain or need urgent care. Please go to the hospital and get that care. It's going to take longer. It might be a little bit different. We know we've seen ERs where people are having to basically take care of folks in the waiting room. This is just kind of where we are. But if you need medical help, seek it, because there will be adverse health outcomes because people are delaying very necessary urgent health care.
Thank you, Dr. Dobbs. Desiree Frazier with MPD. Dr. Dobbs, Dr. Byers, are both of you meeting with school districts? If so, what are you telling them, and how severe would you characterize the number of cases and outbreaks? And the most cases in districts that have not made are the most cases in districts that have not mandated masks for school. So, Dr. Byers, you want to take that?
Yeah, absolutely. That's a great question. And we do meet regularly with the school districts and school boards, and we have since the very beginning of the pandemic, starting back last August at the beginning of the school year. And so, we've had a good relationship with them, and we provide them guidance, and yeah, we've let them know that for these next few weeks, it could be pretty rocky in the schools when we have in-person classes back, especially if they're not adhering to physical distancing and indoor mask use. The schools are just getting started back now, and there's a lot of transmission still in the community settings. I think it's going to be difficult here early on to tease out whether or not there are more cases in districts that have mandated masks versus those that don't. But the way to keep transmission low in the school setting, the way to do the best you can to try to prevent and to try to maintain, in-person learning is really three basic things, guys, and that, or more actually. But it's got to start with making recommendations for vaccination. Everybody eligible really needs to get vaccinated. Consistent use of universal masking in indoor settings, regardless of vaccination status, and wearing the mask right and consistently. And we know that there are some challenges with that. Physical distancing, if you make sure that the children are spread out as best you can in the classroom setting, at least 3 feet, in all other settings, 6 feet or greater. And when you have students that are sick, identify them, have them excluded from the school setting, and don't let them come back for at least 10 days from the onset of their illness, and identify those children who are in close contact and make sure that they're on quarantine. And quarantine means excluded from the school setting. And remember that those children who are fully vaccinated and those teachers who are fully vaccinated don't have to quarantine. They can stay in in-person classes as long as they're fully vaccinated. So the way for us to move forward and to limit the impact on the school settings is going to be those things. But we're going to see outbreaks. We're going to see cases. We're going to see disruptions in the school setting for the next few weeks, I perceive.
Thank you, Dr. Byers. Alyssa with Tutty News is asking, can you speak on the availability or need for booster shots at this point? Also, do you expect a bad flu season as well? Will that cause more stress on the healthcare system? So last year we had a pretty low rate of flu. I mean, we just did not see a lot of flu cases. And I think we're very predicting things. But let's talk about the booster shots at this point. Dr. Dobbs, will you explain who should be considering a booster shot and how should folks go about getting that?
Yeah, so to be clear, there is limited evidence about who potential beneficiaries of a booster shot would be. And when we're talking about booster shots, we're just talking about an additional dose of what folks have had already by and large. We did send out some health communications to our physicians across the state so that they could have these conversations with their patients. We do know that people with weakened immune systems, people who are transplant patients, who have weakened immune systems because of cancer chemotherapy or because of medications for autoimmune disorders, we know that these folks are at high risk for not responding to the vaccine and may need additional doses based on the medical literature. There is no clear and definitive guidance from CDC or FDA at this time. And so we really are depending upon our docs across the state to do that risk assessment. And if they think it's the right thing for them to do, we're supportive. We do think that we're going to get additional information, hopefully within the next few days, about and guidance maybe from CDC. So we will remain hopeful on that question.
Thank you, Dr. Dobbs. Hannah, I think you need to go to the governor's office, but I will put the question out to the team if anyone would like to answer. Hannah is with CNN.
Oh, and I didn't answer the rest of her question, Liz. I'm so sorry. Alyssa, I don't know if you want me to answer that. It's hard to know what the flu season is going to be like. With more normal activity, we expect a more normal flu season. certainly it does from time to time put a little bit of stress on the health system, but nothing like we're seeing with COVID.
Thank you, Dr. Dobbs. So I have this question, which I think is better directed to Governor Reeves, is she was CNN. She says, Governor Reeves concluded a statement on Twitter today with, do what's best for you and your family, and did not outright recommend vaccinations in the statement. Why is there such a disconnect on recommending vaccinations from the governor's office and MSDH? Dr. Dobbs, would you like to answer this?
Yeah, so, I certainly wouldn't get into the nuances of communication. I mean, I know the governor is supportive of immunizations and he knows that this is our pathway out of this. So I know he believes in them personally and thinks that they're safe and effective. So, obviously the public health messaging as far as the vaccinations is really strongly something that we're passionate about because we know it's going to save lives. And so our messaging will continue to be very straightforward and direct so that we can make sure people have the best information going forward.
Thank you, Dr. Dobbs. Maya Martin with the Oxford Eagle. How many of the long-term care facility outbreaks are due to lack of fully vaccinated staff? One facility in the Oxford area has reported that 94% of residents are fully vaccinated, but only 64% of the staff are fully vaccinated. Is that a trend amongst long-term care facilities in the state, Dr. Byers?
Yes, it certainly is a trend among the long-term care facilities in the state. When we look at nursing homes that are having active outbreaks, the staff vaccination rate is less than 50%. Fortunately, the resident vaccination rate is significantly higher, and it's in the mid 80s percent of residents who are vaccinated. We are seeing that the introduction of the outbreaks are coming from unvaccinated employees by and large. When you look at the number of employees compared to the number of resident cases in those outbreaks, the employee cases are twice as many as the resident cases. And we see a vaccination rate among those employee and staff cases of less than 20%. So the way that the virus is being introduced into the long-term care settings is largely through unvaccinated staff and employees. The good news is, though, through high rates of vaccination among the residents, the transmission among the residents has been limited in comparison, and we have seen fewer deaths and much less mortality associated with those long-term care facility outbreaks than we saw in our earlier part of the pandemic. And again, that's a testament to the protective value of the vaccination.
Ms. Judy with the Jefferson Class UMC warned us today that it is seeing a surge of pediatric hospitalizations. In fact, that hospital leadership worries that it will not be able to take an influx if continued school outbreaks happen. How closely are you working with the state's hospitals, which are equipped to care for children, and what emergency measures can be considered to avoid this? I think, Dr. Dowd, can you take this to start with?
Yeah, you bet. So, and I think a lot of these questions are, I'm glad that UMC covered it today because they can give you a more detailed analysis. I mean, we'll do everything we can to take care of our kids. But what do you do about it is you prevent it. If you see a train coming down the tracks, you get off the tracks, and we just haven't had the foresight to do that. We've got to protect our kids. We know what helps. We know that keeping kids masked with some space in an orderly environment is very effective. We know we need to be aggressive with getting infected kids out of the schools and quarantine. So, we'll continue to work closely with schools. We got to work on the prevention piece as much as we can. And, we have regular communications with UMC. I spoke to them this morning on some of these very questions. And, we'll do what we got to do to protect our kids. But, it's not going to be healthcare like it. It's going to be doing what we can do. this is what we call crisis standards of care, and we have entered the realm of crisis standards of care. So don't be surprised that you're not getting what you expect. Don't be surprised if you get sick that you're going to end up in a hospital 200 miles away, because that's the only place they can get you. It's just going to be very different, and prevention is the best way. So, and we still have an opportunity to do some of the prevention, but it's still going to be pretty bad regardless.
Jim, did you want to add anything to that? Yeah.
In addition, is that while many areas of the state have some hospital capability or some pediatric capabilities in their hospital, we really only have one hospital that is a children's hospital in the state of Mississippi. So if UMC is reporting that there's increased pressures there, then we have to be aware that, like Doc said, the crisis standards of care in play. We may end up in facilities that don't specialize in some of those acute care and especially intensive care processes for some of our pediatrics. So it's troubling, without a doubt.
Thank you. Isabel Tech with the Sun Herald is asking, what advice would you give to parents of high-risk kids under 12? Should they be requesting virtual homebound options from their districts to reduce their kids' risk of exposure at school? Dr. Byers, do you want to start with that?
Well, yeah, there's a few things that we can provide guidance on, and I think first and foremost for those families who have children who are less than 12, I think it's going to be important for all those family members to get fully vaccinated in order to protect those individuals who are not eligible for vaccination yet. I think that just like in the school settings and other settings that children under 12 interact with indoors, they should be wearing a mask. I think that when you go to school, that you need to equip your children with the best possible protection. You need to ask your school and about what their stance is on vaccination of their teachers, and make sure that that they're getting the teachers vaccinated, making sure that they're recommending vaccination for the children who are eligible. And I would certainly send your child to school with a mask. I think much of it is going to be a personal decision about what the options are at your school, about whether virtual or distance learning is an option. And certainly I would suggest that parents who are concerned speak to their school about that.
And also, Dr. Byers, and we were asked this last year too, are there any mechanisms for the department to force compliance that the district or private school doesn't report COVID cases? I know we're working with them closely to educate them. Dr. Byers?
We certainly encourage, and it is a requirement for schools to report, the number of cases and students and teachers and the number of students who are on quarantine and the number of outbreaks. And that's vital to our information that we receive, so we can have visibility of what's occurring in those schools. We certainly are willing to work with any schools that we can to be able to facilitate that process. And like I said, it is required, and we encourage all schools to participate in that required reporting.
Thank you, Dr. Byers. Our service, can you send me in the media outlet, and I'll move to Kingfish with the Jackson Jambalaya. In the January surge, deaths reached 47 per day, 33-day average in July 2020, 7-day average is at 12 right now. For example, when the January surge reached over 1,400 hospitalizations on January 3rd, the average deaths reached 47. Why do you think the deaths are much lower than at similar points in earlier stages? Dr. Dobbs, is that because of the vaccine?
No, it's because the nature of this curve. If you remember the curve we had back in the fall, in the winter, it was slow. We had a pretty nasty jump after Halloween and a nasty one after Thanksgiving. And so it takes weeks for cases to translate to deaths. And, if someone gets COVID, it takes them a week to get in the hospital. and then they're sick, and then they get on a ventilator and they spend a few weeks on there before sadly they leave us. So it's really, it's a factor of the delay, because we know it takes a while for folks to succumb to the illness. And also it's risen so quickly. We don't have that sort of backlog of folks who were sitting on the ventilators for weeks who are now not making it. So it's a different surge because it's happened so very quickly. We're going to see a lot of deaths in coming days. It's just inevitable.
Thank you. And Rogelio, I'm sorry, it just came to me that Rogelio with AP is asking, Dr. Dobbs, is the booster the same vaccine that was given earlier this year, or is it a different version of Pfizer?
The ones that we're talking about now are the same exact doses from before. It's basically just like a third dose of Moderna or Pfizer. Not that there couldn't be different varieties of it, maybe one targeted toward Delta or something in the future. Right now, what we're talking about is it's the exact same composition of what we had previously.
Thank you. Akshay is asking, how many booster doses have been administered? I don't know, would we have that information, guys, Dr. Byers?
Yeah, from the data that we have so far, about 8,500 have been administered statewide.
I'm sorry, can you say that again, Dr. Byers?
Yes, about 8,500 have been administered statewide so far.
And at this point, right now, you go to your healthcare provider to discuss that, correct?
Yes.
Hey, Tom, I don't have a question here with you. So, oh, here it is. Okay. When do computer models or internal analysis estimate this wave will peak, and how high could the daily cases be in 30 days, given a status quo in the population? Dr. Dobbs?
The computer models have been notoriously fallible, but some software modeling that we've looked at using sort of simpler calculations is, to reach what I call, a herd immunity. I use that in quotes because it's a little bit not accurate for coronavirus, but to reach that sort of steady state transmission level from a herd immunity threshold, we need about 85% of the population immune. And so we've got a little ways to go on that. So I wouldn't want to talk about the shape of the curve or anything, but I think we've got many weeks ahead of us. I don't see this declining anytime in the near future.
Okay, Dr. Dobbs. Thank you, Dr. Byers, for giving me the answer to that.
I'm sorry, Liz?
Anything to add to Dr. Dobbs' comments?
No, I don't. I just agree with Dr. Dobbs. I think that we're gonna see this trend for several weeks.
Okay, let's see. All right. Kingfish, Mayo reported that Pfizer dropped to 42% after 6 months, while Moderna was over 70%. Do you recommend getting a booster if you receive the Pfizer vaccine, Dr. Byers?
ACIP is meeting now to make some determinations. I think they're meeting on Friday, and we hope that there's going to be some additional guidance from them about when boosters are needed. Right now, we don't have a recommendation for individuals who've received Pfizer to get a third dose just because they got Pfizer vaccine. Right now, our recommendations are for those individuals that Dr. Dobbs talked about who have potentially immunocompromising conditions, that are going cancer treatment, folks who've had transplants and are on medications that suppress their immune system, that they see their physician to discuss the possibility of a booster dose for those individuals.
And Liz, I know some of the question relates to the Mayo Clinic review of cases, and it seemed like they had more breakthroughs with Pfizer than Moderna. I'll tell you, that has not really been our experience looking back at it. Most of our nursing home folks have received Pfizer through our early pushes, and they've had phenomenal benefit from that in regard to cases. So we're not really sure what to make of that right now. There is other studies that show that Pfizer is 88% effective. So we'll sit tight on that and look into it. There was variable distribution from different types of vaccines in different populations based on, our tiering. So there is a concern, could there be some confounding that maybe Pfizer was given more to older, sicker folks than Moderna, as it was available earlier, right? Because Pfizer was the first one on the block, and then Moderna came later. So I think that's data is going to take a little bit of teasing out, and I wouldn't read too much into it right yet.
And if I could add, when you look in the long-term care settings, even with the breakthrough cases that we've had among those residents who've received primarily 2 doses of Pfizer vaccine, what we're seeing is the protective benefit from hospitalizations and mortality. And I think that, you cannot look at these things in a vacuum just for vaccine breakthrough cases. You also have to look at the benefits for the vaccine from a standpoint of limiting severe complications.
Thank you, both of you, for clarifying that. Quentin Smith is asking, and Jim Craig, I'm going to throw this to you. Last year during the pandemic, there were concerns about running out of ventilators. Is this still a concern? Mr. Craig?
Yeah, no, thanks, Liz. We have received some requests from hospitals for ventilators, and we've been able to fill those requests from the resources that we had from earlier in the pandemic. We deployed quite a few in the January wave. Many of those have been brought back in and serviced to be ready for redeployment. And we have deployed a few of those. We also understand from our federal partners that ventilators are in ample supply in the federal stockpile now as well. So we have not heard of any issues about ventilator access at this point.
Will Scribbling, Mississippi today. Dr. Byer said real action is needed to help limit the spread of COVID. What actions at the state level, if any, does MSDH support to achieve this end? Dr. Byer, would you like to start with this?
Well, and certainly I'll throw this over to Dr. Dobbs and Mr. Craig as well. The call to action that I want to make is for those individual Mississippians. I think now is the time that individual Mississippians can make a decision to get vaccinated if you're not, to avoid those congregate settings where transmission can occur, to physically distance, to wear a mask when you're out in public in indoor settings. And that's the call to action that I want for each and every individual Mississippian to take right now, because those simple measures can start to impact the level of transmission that we're seeing. From a broader state level, I'll turn that over to Dr. Dobbs and Mr. Craig.
Obviously we have certain things we can do and we cannot do, and anything we can do, we're willing to do it. But this is a team effort, right? It's not just the Department of Health telling people what to do. It's got to be all of us in this together. I understand people's desire for individual freedoms, but we're all in this together. And what one does, it affects everyone. So, we're meeting a lot with local leaders, people who have leadership roles in their community or within organizations to make sure, and businesses to step up and make sure that they're doing the right things for their employees or constituents. It's so very important right now for everyone who has influence. If you're a church deacon, if you're a mayor, if you're a board of supervisor, if you are president of a social club, to take a stand and say, hey, this is the right thing for us to do, because there's not enough top down that's going to make the good things happen. What it is, it's the grassroots effort to do things at the local level that is going to be impactful. So, we'll continue to augment that. Everything we can do to support those efforts, everything we can do to make, vaccines, testing, monoclonals. I mean, we are really humping it, trying to make sure that whatever is needed by the state of Mississippi is out there. But, we can bring the horse to the water. But you know how the saying goes, we got to have a little help with that last phase.
Thank you, Dr. Dobbs. From Michelle Stoddard at ABC News. Can you confirm whether you requested the USNS Comfort from HHS for additional ICU capacity? Can you give us an update on this request, Mr. Jim Craig?
Yeah, thank you, Liz, and thank you for the question. As we continue to see the need for additional staffing and then also potentially for some additional ICU capacity as this unfortunate wave continues at a pretty high rate, we asked the HHS what would be the possibility of us looking at one of the hospital ships, either the USNS Mercy or the USNS Comfort. USNS Comfort is a resource that is not necessarily available, but could be available. So we began conversations with them. The way that you do that is to put a request in for the resource. So we have requested information about how the USNS Comfort and or its resources, could be the staff from the Comfort, could come and provide assistance in the state of Mississippi.
Thank you. Carl, go ahead and send me what media outlet you are with, and I will pose your question. Isabel Taft from the Sun Herald again asked, she's asking another question. Earlier today, Governor Reeves wrote on Facebook that quote, total hospitalizations remain below where they were at our peak from August 2020. Total number of patients in ICU beds remain at or near our peak levels from August 2020. Is that accurate? Dr. Dobbs?
Yeah, so there's several different metrics we're looking at. So our daily hospitalizations are higher than ever. So that one is higher. The total number of COVID patients in the hospital is slightly below the peak of people who are actively in the hospital. And, the ICU and vent numbers are a little bit higher than they were. So, it's just depending on which data metric you're looking at. But our total number of hospitalizations of people in the hospital is undeniably going to be increasing. We're just in that pathway.
Dr. Dobbs. Tom Garman, would it be reasonable to assume that at some point everyone will eventually contract COVID? Will be vaccinated, some folks. So how would you answer that, Dr. Byers?
Well, it doesn't have to be that way. I think that's what we've been talking about, is ways for folks to prevent transmission in themselves and their families. And we've had some tools available for a number of months now, with the primary one, the vaccination. And we wouldn't have to see this level of transmission if we had higher levels of vaccination in all age groups. I think we could vastly limit it. And I certainly hope that we don't get to a point that everybody will and has to contract COVID to get us out of this. I think that if we can adhere to some of these recommendations that we've been saying, and if we can do it for a short time, we can get the levels of transmission down. We can salvage our hospital and healthcare capacity so that people who don't have COVID but have other medical problems also have room in the hospital setting. And so I think, we are at a point, guys, where everybody needs to be doing everything that they can to prevent transmission. I know we're all tired of COVID. I can promise you everybody up in this office and at the health department is really tired of COVID. But if we can all buckle down as a community and a state, and we're a great state and we help each other all the time. I mean, we've been through many hurricanes where people come out of the woodwork to help each other. We just need to help each other now. And the way to help each other and your neighbor is to get vaccinated.
Well, thank you, both of you. Slim Smith, for Dr. Dobbs, here in Lowndes County, 2 and 3 people have yet to be fully vaccinated. Do you believe local governments should implement new requirements, including mask requirements, if the governor continues to take no action? Dr. Dobbs?
Yeah, no. So, action at the local level is so very important to protect our citizens. And we've seen such great leadership because we know, you care about your neighbors. Now, without a doubt, we do support and recommend masking indoors, and city and local indoor mask mandates do make sense. And, we're supportive of people doing that. But I do want to just be very careful to make sure we realize that a lot of the transmission that we see are in situations where people don't wear masks, right? That's going to be in the household, or maybe at a barbecue, or at a bar, having a beer with your buddies. So it's more than just a mask. I mean, the masks are useful in situations where you're indoors, and when I've been to some indoor meetings, we've been separated and I've been wearing a mask and I felt very comfortable with that. But we got to remember these other social settings. That's been our Achilles heel this whole time. Undeniably, that's going to be one of the reasons why we're seeing a lot of transmission out of Neshoba County. If you could put a bunch of people indoor without masks who are not immune, you're just going to see outbreaks. It's just inevitable.
Dr. Dobbs. Isabella Murray with the Sun Herald. Governor Reeves has said that the real challenge facing Mississippi during its fourth wave is not a lack of beds, but lack of staffing. Can you talk about this? Hospitals on the coast are reporting that they are also out of beds. Jim, could you take this one on? Mr. Craig? Well, I think we lost Mr. Craig for a second. Dr. Dobbs, can you take that?
Yeah, you bet. So it's mostly staffing. It doesn't mean that certain areas don't have bed issues, but across the state, we do have a lot of wings of hospitals that are unutilized because they haven't traditionally been needed, or not staffed, or there hasn't been static demand. Not that there's not bed challenges from here and there, but by far staffing is the primary resource challenge.
Thank you, Dr. Dobbs. Most of y'all are helping me out with this, and I know a lot of you, but please identify when you ask a question who you are. Brandon, let me know who you're with, and I will be happy to ask your question. Rogelio with AP is asking, so many Mississippians are without a personal physician or are dependent on receiving their health care provided by a free clinic or walk-in. But the MSDH and other CDC public service announcements stress seeking consulting with them before seeking boosters. What are those supposed to do? That is a great question. So let's start with you, Dr. Dobbs.
Yeah, so I think that's going to be a more relevant issue when if boosters become more broadly recommended. If you're on cancer chemotherapy, or if you are a transplant, very few of those folks don't have an active physician. So I think for the group of people that we're talking about now that really need to be talking about this, they do have a physician because it's a very small subset. But we are looking at options that are going to make these things more available. We do need additional guidance and feedback from CDC and FDA to be more broad. So, stay tuned. I think as we talk about other populations, that's going to be a different scenario when we acknowledge that we'll need to have those available universally.
Thank you, Dr. Dobbs. Okay, Carl is asking, has Mississippi run into any difficulties acquiring COVID-19 tests? I am curious as to whether the increase in demand for testing, particularly as schools prepare to reopen, has resulted in any supply difficulty. Mr. Jim Craig, are you back? No, Jim is not back. Okay, so Dr. Byers, can you cover that one?
Yeah, and I think I heard most of the question, and I think it was related to what our supply of testing is, and do we perceive that there may be some limitations with increased testing? And the answer to that is no. We are continuing to work with the schools to provide them with test kits for those schools that are interested in performing their own screening testing. We've made those widely available, and we do have a continuous supply of those test kits coming in. Additionally, we've got community testing throughout the state, and we have a number of providers who are doing testing throughout the state. Really, the supplies are not the issue at this point, and we anticipate that we're not going to have some limitations on our testing supplies.
Okay, Thank you, Dr. Byers. Jackie Mass, with Fox 13, are you concerned you will see more COVID cases and deaths in young people with school being in session, especially since several schools are not requiring masks or vaccination rates? So I think we've discussed that, but Dr. Byers, why don't you take that?
I think that there is a possibility that we will certainly see additional cases in younger school-age children. I think there's a possibility that much of that transmission may occur at the school setting. We're just going to have to see how that translates moving forward. We do know that there's been a significant impact on the school setting so far, and the more cases that we have in younger folks, there is a potential that we could have more hospitalizations, that we could have more complications such as multi-system inflammatory syndrome that can be severe in children. I think, it's hard to know at this point, but there is certainly a possibility that we will see increased cases and hospitalizations in young kids. And I don't know if Dr. Dobbs had anything to add to that.
No, I think you're good. I'm with you.
Thank you, Dr. Dobbs, Dr. Byers. Desiree Frazier with MTV is asking Dr. Dobbs, how many children are hospitalized out of state, please?
That's not information that we have. The way that we collect this information is through a different system, so we don't have state of residence available. I'm not sure that we would be able to get that readily unless Jim knows of a mechanism. But we'll have to investigate whether or not that's something we can track.
Okay, thank you. I saw Jim shake his head no. So Jim, did you have anything you wanted to add to that?
No, it is something we could explore, but it's not something that we currently collect that way.
Okay, thank you. Rogelio with AP. Can I walk into a free vaccination site like the COVID vaccine, like the COVID vaccination at Jackson State and see a booster? I believe that is healthcare providers, but Dr. Byers, would you?
Yeah, I'd be pleased to. So our guidance is based on an individual seeking an assessment and getting assessment from their physician to be able to make that determination regarding the need for a booster. And it really needs to be on that individual one-on-one basis between the physician who's evaluating that individual's potential underlying medical problems that may place them at risk and discussing that with their patients. And so it's really available in that doctor-physician relationship. Certainly or patient relationship. When we get additional guidance from CDC, we hope that that's going to allow for broader recommendations for booster shots. But for now, we recommend that individuals who are interested in a booster or think that they may need one to contact their physician.
Thank you, Dr. Byers. Hi, Brandon with WBAM. Across the board, we have seen another big spike in the cases here in the Pine Belt. Compared to Jackson metro area, is there a greater increase in the Pine Belt or the Jackson metro area? Dr. Dobbs?
We're seeing a lot of cases everywhere in different hot spots. I know that there's a lot down there too. So I don't think that it's specifically disproportionately worse in the Pine Belt. Dr. Byers, I don't know if you have anything else, but I mean, there's a ton of cases down there. There's no doubt. But there's a ton of cases everywhere.
And, we have county level data on our website. I invite folks to take a look at that we update on a weekly basis that really lets you know what you're going on in your county, and you can look at surrounding counties. But I have to tell you that we're seeing increases really in all counties, guys, across the board.
Thank you. We have Hannah again with CNN. Do locations of the pediatric hospitalizations correlate with the school district with higher cases? Dr. Byers, do we know that yet?
I don't know that we can say that at this point. And remember, when pediatric hospitalizations occur, we have one primary pediatric hospital in the state, and that's where the kids are being transferred to, and those kids that are severely ill are being hospitalized. Jim?
That's correct, Doc. I mean, we have the one pediatric hospital here in Mississippi. Of course, in the northern part of Mississippi, a lot of times we'll move pediatric cases to Le Bonheur up in the Memphis area, and also in some of our surrounding states. But again, it's not just Mississippi that's seeing increases in cases right now. So those opportunities are becoming less and less for us to be able to transfer patients out of state to some of these other facilities.
Thank you, Mr. Craig. Brandon is asking, folks in many places in the Pine Belt still see a potential for herd immunity as a possibility to overcome COVID as a whole. With the Delta variant now among the communities, is herd immunity out of the equation now? Dr. Dobbs?
Yeah, and that's why I'm cautious to say herd immunity, because, you know, these respiratory mucosal viruses are different than like measles and smallpox. And so, you know, you can catch them again. It might be a little bit more like flu in some regards. But can we get to low level steady state transmission and mild clinical illness? Yes, I think so. And, you know, just based on what we're seeing, you know, the vaccine based on previous strains is providing substantial protection for Delta. So I do think that we can have a population protective effect, that where you would see some COVID and it might sort of blend into the background. If we look at what happened with, you know, 1918 Spanish flu, you know, H1N1 was the predominant strain for years after that, but it sort of blended into the background as seasonal flu without the same sort of morbidity and mortality.
Thank you. So many people are online preaching ivermectin. They claim it works, and doctors are withholding a drug that is saving humans for early treatment of COVID. Does MSDH have an opinion on the benefits, if any, of this drug for COVID treatment?
Yeah, so, you know, this has become an online phenomenon. This is kind of like the new hydroxychloroquine. So, you know, the data there, it's curious, you know, specialists in the field see that it has no value. Internet pundits think that it's salvation for all. So what randomized controlled trials have been done show that it doesn't work. But there haven't been as many controlled trials for ivermectin as there were for hydroxychloroquine, which shows clearly does not work. So there's no real reason to think ivermectin is going to be effective. Some doctors do want to use it. We certainly don't impede them from using their clinical judgment, but I always need to make sure that people know it should always be an and not an or. If people get COVID, if you want to give them ivermectin, you know, that's your choice, but please give them the things that we know work, like the monoclonal antibody treatment, because we have clear evidence that it reduces hospitalization by 80–90%. There is no such evidence for ivermectin.
Thank you. Dr. Byers, if you want to add anything to that from a medical perspective. Okay. Let's see. Rogelio is asking, are the booster shots incentives to vaccinations that we are given? The answer to that is yes. Michael with MPD, good afternoon. In the statement, the governor said total hospitalizations remain below where they were in August. Oh, I think we answered that. Would you guys agree that we've answered that already? Okay. Michael, write me back if you didn't get what you need. Okay. Let's see. Oh, let's see here. Sarah with the Clarion Ledger. My apologies if I missed this answer. If all schools have to report COVID-19 cases and quarantine numbers, why are there only 43 reported counties? Is it because not all schools have started? I would assume that would be part of it. Dr. Byers, you want to take that?
Yeah, we're just getting started in the school session. We anticipate that that's going to increase as we move forward and schools get online and they have the ability to report. The schools are going through a lot right now, and they're trying to make sure that they've got the kids coming back safely and have plans in place to be able to respond in the event of cases and outbreaks and quarantine. And so we anticipate that that's going to increase over time.
Thank you, Dr. Byers. And I guess my advice to reporters would be, if you don't see a school on the list, call the school. It's self-reported. So call the schools and ask them if they report. let's see, Brandon, again with WDAF, for folks that are trying to use other preventers like ivermectin or remdesivir against COVID-19 in the Delta variant, what would you say to them and why these other preventatives don't work to fight COVID? You kind of touched on it. Dr. Byers, Dr. Dobbs, anything you want to add to that?
Yeah, well, remdesivir, I think is probably not plausible because, I mean, remdesivir is a useful treatment for people who have COVID, but it's an infusion. So it's not something you would use for a preventative, and it's also crazy expensive. So that's not really plausible. Again, with the ivermectin, you know, it's internet alchemists have decided that this is the cure, and there's really just no data for it. Now, that in controlled trials, and that's the whole thing. I mean, the standard for treatment is a controlled trial to show something really works, and the controlled trials don't show any benefit for ivermectin. Now, if a doctor wants to use it, again, like I said, that's their clinical decision. We're not going to get in their way. There aren't as many negative trials for ivermectin as there are for hydroxychloroquine. Again, I would just reiterate that, you know, it should always be an and not an or. But I have, for a whole host of reasons, you know, I and the Infectious Disease Society of America and a lot of other experts who do this all the time do not think that it's going to be very useful.
And Liz, I would just add that we have a preventative for COVID, and it's called the vaccine.
That's right.
And it's proven safe and effective. Why are we going to look around for things that are not working when we have demonstrated that the vaccine is safe and effective and it works?
I don't know the answer to that, Dr. Byers. It's something we grapple with every day. The best thing to do is get the vaccine so you don't get COVID. Okay, Craig Ford with TBA will end our press conference today with your question. What recommendations do you recommend for the workplace during this latest surge? What, if any, changes have been made in that regard for those working together in the same building at MSDH? Dr. Dobbs?
Yeah, no, it's a great question. We have universal indoor masks at the Department of Health buildings, regardless of vaccination status, consistent with CDC guidance. We do space when we do have to have meetings, but we also try to optimize and maximize virtual meetings. All of our staff meetings are now done virtually. So, you know, it's easy to be safe or safer if we use the modern tools we have available to us. So we're kind of, you know, doing the same stuff we were doing before, but we're maintaining, you know, the same and in some ways even better productivity by not having to drive from place to place for personal meetings.
Well, thank you to all of you. I don't see any more media questions. I thank the media for their participation in getting accurate information out. On behalf of Dr. Thomas Dobbs, Dr. Paul Byers, and Mr. Gene Craig, I'm with Charlotte, wishing you a good afternoon.